What about body contouring?
The commonest area is breast surgery, of course, but breast augmentation, breast reduction and breast lifting, which officially is called mastopexy. Breast augmentation, an interesting procedure. It uses an implant, as everybody knows, to push the breast forward. And it's had a bit of a checkered history, really. It's been being done in its present form since 1962, that's to say using silicone implants. And the most data is still available on for silicone implants. We've got a lot of data, and I think there isn't any evidence that they have done or do anybody any harm. But there are a lot of issues around breast augmentation. As with any operation that uses a prosthetic material, am I going to have to do it again? Do I have to change it after a particular period of time? These are questions people ask. And the answers to those questions are, if you have any operation that uses a prosthetic, it's likely at some time in your life you will have to adjust or remove or replace. Either because you've changed, for instance in breast surgery, you hadn't had any children, now you've had 6 children, you've changed shape, or because the implants have changed, for instance, they've become firmer, perhaps what's known as capsular contracture. There is not, however, a specific time that you should do that. I was lecturing at a big meeting in the States last year on breast surgery, and the general feeling there was that, quotes, after 10 years, you should perhaps suggest to your patients that they might start thinking, it's all very woolly, about changing them. But I think the easier advice to give actually at present, if there aren't any problems, don't interfere. But it's certainly something you need to bear in mind. And breast augmentation, again, is an operation which has become very commercialised. There's a lot of talk about things which aren't very realistic. You can't do a breast augmentation without leaving a scar, for instance. You can hide the scar, for better or worse, but every breast augmentation leaves a scar. And there's lots of discussions to have about what type of implant you use, what shape of implant you use, what size of implant you use. Do you put it behind the breast only? Do you put it behind the muscle? Do you put it half behind the breast, half behind? It's a big discussion, and the patient will make those decisions based on discussion between us. And the decisions are made based on their anatomy primarily, but also what it is they're looking for, their lifestyle. Do they go to the gym, for instance? Because if you go to the gym and you push a lot of weights, if the implant is behind the muscle, the pectoralis major muscle, when that muscle contracts, it'll flatten the implant. So if you're wearing a tight leotard, that may be visible. So all these lifestyle factors are very important when you come to make a decision. People ask about, so how do you choose the right size? Well, the honest answer is, if you want the breast to look real, then rule 1, don't try and make them too big, because if you do, they'll always look unnatural, tight, and they don't move properly. And it has, again, to come from a discussion. If somebody came along to me and said they want to go from A cup to a G cup, then I'm not the right man to do that, because that's not going to look like a real breast. And I would say, as a general rule of thumb, if you increase cup size by about 1 cup size or a cup size and a half, it will look natural. If you go much bigger than that, then you start bordering on that which doesn't look natural. And of course, it's the cup size which is a measure of breast volume, not the inches dimension, which is a measure of the chest. Cup size is variable. If you were to go to 3 different bra manufacturers, they won't be identical, although in theory they should be. Something I do find helpful is the routine that I follow is to discuss with the patient, look at their photographs, go through all of the things I've talked about and more. And then I'll estimate what I think the right implant for them would be. They'll then spend 20 minutes with my nurse trying implants inside a bra and see what they come up with. I don't know what they come up with, and she doesn't know what I've come up with. And then we put the two together and see how close we are. Generally, we're pretty close, actually. And although trying an implant inside a bra is by no means an exact measure of what it's going to look like afterwards, it does give you a good idea, and it also, perhaps more importantly, gives you a good insight into what's in the patient's head. Another question people often ask is, does it change your breast cancer risk? The answer to that question is no, but there is a tumour now which I think we became aware of in 2009. It's very rare. It's called an acute large cell lymphoma, and it's associated with the capsule. That's the reaction, the body's reaction to the implant. It produces like a scar around it, which we call a capsule. And this thing called an acute large cell lymphoma seems to be associated with the capsule. It's very rare. I couldn't give you a numerical statistic for it. And it presents usually with rapid and obvious swelling on one side. And I certainly it was described first in Australia, and I was visiting professor in Sydney in 2009 at the meeting, to the best of my memory, where it was first described. And now there are reported cases pretty much all over the world. The numbers are still very small, but it's certainly something I do tell patients about. Breast reduction, different procedure, because of course it doesn't use any prosthetic device. And if you ask most plastic surgeons around the world for an operation which is virtually universally successful, breast reduction, most people would say. I think because although it's listed as a cosmetic procedure, actually it has a significant lifestyle implication, because women who have large breasts often will have backache, neck ache, shoulder ache. They find it difficult to wear clothes. They often feel uncomfortable, embarrassed about their bodies. Young women will say they get fed up with people wolf whistling at them. All of these, going to the gym, sports, all those things which are difficult. So although it's talked about as a cosmetic procedure, there's a big lifestyle implication to it, and it's a remarkably successful operation. As is breast augmentation, if your criterion for success is a happy bunny at the end of it. But there are implications for breast augmentation which don't apply to breast reduction. And of course, breast reduction not only reduces the size of the breast, self-evidently, it also lifts the breast. And then the third operation is mastopexy, breast lifting, or breast uplift, as some people will call it, which is designed to reshape breast tissue, but not to make it bigger or smaller. However, it is possible, of course, to use an implant at the same time as lifting a breast. I have to say my own philosophy, and if I were a woman, I think, knowing what I know, my philosophy would be that if I could do what I needed to do without a prosthetic, without an implant, then I would, because then I take all those long-term considerations out. And it doesn't matter if you're using a prosthetic for a heart valve, for a hip, for a knee, whatever. They're not biological materials. So there's a whole list of implications to that which is not present if you're not using them.